Whenever an individual suffers from Bell's palsy, the biggest concern that bothers them the most is the recovery timeline, when they will get back to normal. And hence, I decided to make this video to help you understand what is the recovery timeline for Bell's palsy. So, if you who are someone who is suffering from Bell's palsy, and if you have this pressing question inside your mind when you will recover from your Bell's palsy, then this video is definitely for you. So, make sure to watch this video till the end. Let's begin. Hello friends, I am Physio Meghna Dave. I am a neuro-rehabilitation physiotherapist and I have been helping patients with Bell's palsy, synkinesis from 2017. In my experience, I have seen patients from all stages who recovered in one day of Bell's palsy to people who have not recovered even after 15 years. So what makes them different? What is the real cause behind delayed recovery process and what is a normal recovery timeline? This is a very big question that everybody have in their mind. So let's understand this. Friends, when it comes to Bell's palsy, the cause behind the Bell's palsy determines how long it is going to take for you to recover. Even though the Bell's palsy or facial paralysis is paralysis of one side of the face, the cause behind it will be varying for a different individual. For example, if we look at the literal meaning of Bell's palsy, it means it's an idiopathic condition where the cause is not known. Majority of time it's the inflammation on the nerve that has caused damage on the nerve and due to which the face has got paralyzed. But at the same time, different viruses and bacteria when attack your nerve, even that will lead to facial paralysis and will give you the symptoms of Bell's palsy. These conditions could be in the form of Ramsay-Hunt syndrome, Lyme's disease, etc. Here the viruses that have infected your nerve is viruses like herpes simplex virus, varicella, zoster virus, etc. That's not all. Certain other viruses like Epstein-Barr virus, cytomegalovirus, and viruses of mumps, measles, chickenpox that are dormant in your body sometimes gets activated and can damage to your nerve as well. When it comes to other neurological causes, tumor in your brain, damage to the nerve following a surgical procedure, a stroke attack. At the same time, infection inside the ear can also give you facial paralysis or Bell's palsy. In order to help you understand how long this is going to take for your nerve to recover, you need to watch this image. This image is of the levels or grade of nerve injury. The grade of nerve injury can be classified into three types, which is called as neuropraxia, axonotmesis, and neurotemesis. As you can see in neuropraxia, there is an inflammatory change that's present around the nerve canal and there is no damage that has happened to the central sheath here. This is the most mildest form of Bell's palsy and the recovery expected here is the fastest. But if you have got this next level of nerve injury, which is axonotmesis, here the damage has happened to the internal sheath as well. There will be Wallerian degeneration, which will cause the recovery timeline to be far more exceeded. And when there is a physical damage to the nerve, where your nerve is either damaged or cut in two pieces or is partially cut, in this scenario, there will be a very severe damage to the nerve and there will be a very significant delay in the recovery process. Having said that, we all are blessed with the concept of neuroplasticity. What does this say is that if the neurons die or else get damaged, the neurons that are adjacent to it can take over the task of the nerve and you can achieve your movements back. But if we see at the normal timeline of the recovery, the speed for which the nerve heals or recovers is 1 mm per day. That's why for any patient who suffers from Bell's palsy, they should definitely wait for 90 days for the natural or normal healing to happen. I'm not saying that you don't need to take your medication. Yes, medication is very important to be taken here. Please don't ignore or avoid taking your medication. Make sure you take your medications on time, because if your medication goes in your first 72 hours, then the inflammation that you are seeing in the nerve will be reduced very significantly and your recovery chances will be very high. But if you ignore taking this medication, then this inflammation will last longer and can create some permanent damage to your nerve. That's why taking your medication on time is pretty important. If we look at a normal or else a usual Bell's palsy where the inflammation is not too high, in that cases, this will be the following milestone. The first day or two will be on the maximum amount of paralysis that you will see on the face. It will be progressive in nature and you will see that your face will be completely drooped. Difficulty in closing the eyes will be there. At the same time, speaking and chewing will be a problem. There could be ear sensitivity, ear pain. At the same time, there could be a loss of taste sensation in the front part or tip of your tongue. As you progress towards your week 1 and week 2, you will observe that the movement starts developing again. But this will not be a visible movement, but majorly this would be in the form of contractions that would be felt more than seen. You will see that there are slight contractions felt on the forehead, eyes, nasolabial fold, cheeks, chin, etc., which eventually will progress forward by week 4 and 5, which eventually turns into some visible movements on the face. This progress continues to happen and you will observe that by end of your 6th or 7th week, your face will have partial movements already present on the face. And if the recovery continues to happen, you will reach to a stage where your face will be absolutely normal by 3 months. But if you see some delayed recovery or else some unusual scenarios, in that cases also there will be absolutely no movement seen within first 4 or 5 weeks, and later on there will be mild development that will start happening. This totally will be dependent on what was the cause behind your Bell's palsy or else how is your immune system. If you see, you will observe that after your movements have come back, you might recover completely and you start living your life on a day-to-day basis, but there could be certain partial zones of weakness present on the face. This could be in the area of nasolabial fold, making your cheeks feel little weaker compared to the normal side. Eye blinks, even though are happening right now, but I will feel slightly weaker compared to the affected side, compared to the normal side. And your expressions whenever you laugh loudly or else whenever you feel sad or whenever you yawn, you will see that your facial expressions will be deviated. But as you will recover further, this symmetry will come back again. But in cases where the symmetry doesn't come is the scenario where synkinesis kicks in. This is a devastating complication of Bell's palsy where due to delayed recovery or incomplete recovery, residuals are there and this makes your movements incomplete and haywired. Let's say whenever you are closing your eyes, you will observe some movement felt around your mouth and your chin region, sometimes in the neck region as well. At the same time, whenever you are trying to smile, you will observe that your eye closes. This majorly happens due to co-contraction or else involvement of the other muscle groups which are trying to help the muscle to complete the movement. Now, even though you have recovered, the brain has developed this habit to help these muscles and subconsciously you are trying to do that again and again. So synkinesis is an absolute different condition, but it's not a disease, it's a mechanical problem, and that's why it doesn't require a treatment or as a cure, but require right mindful practices. So friends, this was a brief about what could be a recovery timeline for Bell's palsy look like. Remember this, 3 months is something that you should definitely consider as a scope of 100% recovery for any individual of any kind of facial paralysis. Please don't hurry to see movements fast. As you will recover, the movements will inevitably come back. Sometimes it might take 6 months as well, but it doesn't mean that you will never recover again. Even if your recovery takes 1 year, still it's okay. It's worth waiting and patiently working on your facial nerve recovery. So don't give up on your face. Keep on working. On that note, I'll end this video here and I'll see you in another video. Thank you.